Millions of people struggling with severe insomnia and muscle tension try the exact same approach. They buy a standard magnesium supplement, take it for a few weeks, notice zero relief, and drop the routine entirely, assuming the mineral simply does not work for them. The absence of relief usually stems from outdated testing methods, insufficient dosing guidelines, and the low-grade forms favored by major manufacturers. Swallowing a pill guarantees absolutely nothing if the biological rules of absorption and cellular demand are completely ignored. Consider the frustrating experience of lying in bed, physically exhausted, but mentally racing, the classic state of being tired but wired. This is routinely blamed entirely on elevated cortisol from chronic stress. High cortisol manifests through excess abdominal fat, morning blood sugar spikes, and an impaired immune system prone to frequent infections. But an entirely different cluster of symptoms mimics stress: persistent insomnia even when bone-tired, restless legs, chronic jaw tension, and involuntary muscle twitching. These specific markers point away from psychological stress and toward a precise physical state known as neuronal overexcitation, which is directly driven by a severe mineral depletion. Attempting to treat this specific state of overexcitation with stress reduction techniques or adaptogenic herbs will consistently fail. You cannot meditate your way out of a physical cellular deficit. The brain balances two forces: glutamate, the accelerator, and GABA, the brake. Magnesium physically inserts into NMDA receptor gateways, blocking the accelerator. When depleted, this block drops out, and neurons flood with a continuous stream of excitatory signals. Without adequate magnesium to plug those receptors, your brain is biologically incapable of shutting down, no matter how desperately exhausted your physical body feels. Most people believe they have enough magnesium because their annual blood work says so. But standard serum blood tests only measure the tiny fraction, roughly 1%, of the body's total magnesium that happens to float in the blood plasma. Even advanced red blood cell tests miss the mark. About 65% of your intracellular magnesium is locked inside mitochondria, and red blood cells do not contain mitochondria. A patient can receive perfectly normal test results while their actual cells are starving. This standard supplement label shows the recommended dietary allowance, established in 1997, that 350 to 420 milligrams is merely a survival threshold to prevent severe deficiency diseases in healthy populations. It was never designed as a therapeutic dose to correct active symptoms. Relying on these standard blood panels and outdated bottle labels creates a dangerous false sense of security, effectively masking deep whole-body depletion. Then there is the manufacturing flaw. If you buy an inexpensive supplement off the shelf, it is almost certainly magnesium oxide, a form favored by manufacturers because it is incredibly compact and cheap to produce. The mathematical reality of oxide is dismal. It has a roughly 4% absorption rate. That means a standard 400 milligram capsule delivers a microscopic 16 milligrams of usable mineral to your brain and cells. The physical consequence is that the unabsorbed 96% remains sitting in your gut. It acts as an osmotic agent, drawing in water and causing cramping and diarrhea. Millions of people are effectively taking placebo-level doses while enduring harsh gastrointestinal side effects, which only reinforces their false belief that magnesium therapy is useless. The medical community once understood how to utilize magnesium for severe neurological issues. In the 1920s, Dr. P.J. Weston tracked patients with severe agitated depression. Using massive doses, roughly 90% demonstrated meaningful clinical improvement. Weston's methodology succeeded because of the dose. His patients were not taking a 400 milligram oxide pill. They were administered massive daily quantities, ranging from 500 to 1200 milligrams. The biological mechanism for treating these symptoms remains valid. The challenge is restoring the massive scale and chemical form required to trigger a response. To correct a true deficit, the protocol must start with the right form, magnesium glycinate. It has an absorption rate of up to 80%, and the attached glycine molecule independently promotes that calming GABA activity in the brain. The therapeutic target is high. Individuals with active symptoms often require between 600 and 1400 milligrams daily, a dose that should always be cleared by a doctor, especially if you have kidney or heart conditions. That massive daily dose, must be divided into smaller quantities, taken evenly throughout the day. This ensures sustained tissue saturation and prevents gastrointestinal distress. Finally, it requires a full 30-day commitment. Initial neurological calming often occurs within 48 hours, but it takes weeks to fully replenish deep mitochondrial stores. By recognizing the illusions of standard labels, flawed tests, and cheap supplements, you can finally execute a genuine therapeutic protocol, successfully flip the neurological off switch, and fully reclaim your rest.